Good morning, my name is Ricardo Sanchez, urologic oncologist. I wanted to show you our setup here in the operating room to do the transperineal UroNav MRI ultrasound fusion biopsies. Basically, the patient comes in with an IV, we give him some sedation so the patient stays comfortable. You're not going to feel any pain at all. You're not going to notice anything. Okay, the procedure lasts about half an hour, maybe a little longer for patients with more than one nodule. I wanted to show you the machine. This is the setup here in the operating room. This is where the patient will be, you'll be laying flat. We have the ultrasound machine, and then we have what's called the UroNav. The UroNav is a navigator. And I'm going to show you an example of a patient who has a nodule at the left apex. So why don't you zoom up here, and here we have the axial, sagittal, and coronal planes, which means front, side, and top view. So here is a nodule. You can see the prostate here. This is the core of the biopsy that went through. That's our first shot there. So you can see how it went through the nodule here. Okay, and this patient turned out to have clinically significant prostate cancer, so what's called grade group 3 prostate cancer. Okay, so I'll show you an image of the end result. So this is the prostate. It's a 65-gram prostate, and then I usually take 4 cores of the nodule. I start with that, and then take 12 cores, what I call systematics, all done through the skin. So the needle never goes through the rectum, and there's a lower risk of infection. And then these are cores that we take in what's called the transition zone, so the more anterior cores. So procedure will again last about half an hour, and you'll have some blood in the urine maybe for a day or two. You may have some blood in the semen for sometimes several months, but that's okay. You can have sexual relations the following week, and that's not a problem. Some patients may have difficulty urinating after the procedure. It's very rare for someone to need a catheter, but sometimes they do. I would say it's about 3% of patients. So it's a huge advantage to do the MRI before the biopsy, because first of all, you know what you're looking for, you know where you need to go. And secondly, if you didn't have the MRI and your biopsy was negative, you're always going to have sort of the question as to whether there was something there that you didn't target, you didn't go for. So this is basically the nodules. When we don't see them on ultrasound, the machine will draw us a cartoon of where the nodule is, so it helps us find it. So hope this was helpful. Have a great day.